So, Dr. Todd, tell me, what does chiropractic care do for whiplash cases?
Well, whiplash cases are typically a problem in the neck. Many times it can be an auto accident. There can, of course, be other type of traumas. Anytime the head whips forward and backward, though, it's almost like snapping a whip, if you will. And so the head can reach very high rates of speed, and they can damage the joints and the discs in the cervical spine area. And as a result, people end up with problems with that. And many times, when we see a post-whiplash type condition come into our office, we will have a normal cervical curve on this yellow line. This x-ray is showing that this neck is straight up and down, or it's lost its normal curve. The normal curve is there to kind of act like a shock absorber, and it also protects the spinal cord and the spinal nerves that are coming out. When that whipping occurs in that neck region, it misaligns that. And this one is an old whiplash condition, and you can actually see degenerative changes. We have degenerative disc disease going on down here in the lower neck, bone spurs, or arthritis starting in that area because of that damage. And so the big key with whiplash type injuries is to get care as soon as you possibly can. The longer these are there, the more problems that develop. And so chiropractic obviously works with the neck. In particular, in our office, we use Atlas orthogonal to restore the top bone in the neck and restore the structure and the function of the neck joints to as near normal as possible. So we try to return as much of this curve to this neck as we possibly can. So again, these discs can stay healthy, these joints can operate like they should, and the spinal cord and the spinal nerves can be protected like they should, and then obviously your nerve function can do what it's supposed to do, what your body is designed to do. Many people say, oh yeah, well I was in a high-speed impact, yeah, I've got a whiplash, and they kind of understand that there may be a problem. They go to the hospital, the emergency room, they take pictures, they say, oh no, nothing's broken, you're all fine. Well, that's not really the case, and what happens is down the road they end up having neck pain, shoulder pain, headaches, tingling and numbness in the hands, anything that might be associated with nerve problems in the neck itself. And sure enough, it's probably originated from that whiplash where they were just a little sore for a couple of days afterwards. Maybe they used some ice and heat, or maybe they got some anti-inflammatories and some pain meds, and after a week or two it felt better. The problem with it is 6 months to about 2 years down the road is when we will see major problems really manifest from this. And you know, if you're in a high-speed impact, you can understand how that would damage the neck. However, current research has shown that a 4-mile-per-hour impact, just a little bumper to bumper that doesn't cause any damage to the car itself, can cause ligament damage in the neck itself. And so we don't realize that when it happens. You know, we have that little bump and all of a sudden you have an adrenaline rush and you really don't think much about it. And again, you might have just a little neck soreness for a day or two, but you don't think much about it because it was just a little bump. It didn't even damage the car. But what happens then is we'll see people come into our clinic. They'll be sitting in our consultation room and saying, yeah, I've got neck pain on the left side. It just started last week, and I get some dull headaches, and I have had some pain going down into my shoulder. And we'll say things like, well, have you ever been in an auto accident? Well, yeah, about a year ago, but I wasn't hurt. Well, you were hurt, you just weren't hurting yet. In other words, there was some damage that occurred, and it wasn't causing symptoms, so you didn't think there was a spinal problem, so to speak, and now we've got the symptoms there. So what I tell folks is the very best thing they can do anytime they're in a whiplash type situation, whether it's a fall, whether it's an auto accident, even if it's just a little, you know, you're in the line at McDonald's and there's a little bumper to bumper there, it can be enough to cause some damage. And so get it checked now versus later, because the longer that damage is left there, the more problems that you have. Kind of like a leaky roof. You get a little drip coming in the roof and you leave it there for 2 or 3 years, you're going to have bigger problems down the road. Or if you've got a small cavity in a tooth, you can get that fixed relatively simply now, but leave it in there for 2 or 3 years and now you've got major damage going on. So that's what we see that comes into our clinic. So I just encourage everyone and anyone that's been in an accident, that whether you had symptoms or not, to get to the chiropractor, allow them to check and see what your spinal structure looks like and see if there has been some damage and get that corrected as soon as possible.